anti-diabetic agents like EDTA or DMSA, but garlic. Yeah, so this is something that we've been working on. We're in the botanical section now. It's a familiar food, has surprising well-documented chelating properties. It doesn't just detoxify, it binds and removes heavy metals like lead, mercury, and cadmium with fewer side effects and greater nutritional safety. There's a landmark study that I want to put out there for you guys. It's published in Basic and Clinical Pharmacology and Toxicology. 117 male industrial workers with chronic lead exposure, and participants were randomized to receive either garlic tablets, 3.6 grams per day, versus D-penicillamine, so it's a pharmaceutical chelator, or placebo. After 4 weeks of the study, the garlic group's blood levels dropped significantly from about 20 grams per deciliter to 12 grams per deciliter, on par with the drug group, but with fewer adverse effects. So, like nausea or skin reactions, and are even more notable. So, garlic improved symptoms such as headaches, irritability, and digestive issues related to lead toxicity. And why does garlic do that? The power of garlic lies in its sulfur-based compound, especially allicin or S-allylcysteine or SAC, and diallose disulfide. So these are molecules containing thiol groups. So the same chemical hooks used in drug chelators to bind metals and escort them out through the urine. So crucially, garlic does this without stripping essential minerals like zinc or calcium, which is common when we do EDTA, which is a major limitation of many pharmaceutical chelators. So now people often ask, can I just eat garlic, right? You can, but to match the chelating dose used in it's the Canush study, that's what we call it, you need to eat 6 to 10 raw cloves per day. That's not practical or even tolerable for most. Also, allicin degrades with heat and time, so cooking garlic greatly reduces the potency. Instead, aged garlic extract or standardized tablets at 1.2 to 3.6 grams per day provides reliable dosing, better absorption, and greater clinical consistency. And we always talk about, yes, like natural chelators such as cilantro, chlorella, but garlic actually has stronger human data. Cilantro and chlorella can mobilize metals, but they don't always bind them tightly, which may lead to redistribution, a theoretical risk where toxic agents can get moved but not excreted. So garlic, especially in aged or oil-based forms, is safer, more stable, and better tolerated over long-term use. So the final takeaway here, whether you are supporting detox in postmenopausal women, so we handle that in the hormone world, they release lead from their bones, in our, of course, and also managing chronic low-level exposures, garlic is a gentle, effective chelator that strips the body without stripping essential nutrients, making it an ideal addition to integrative detox protocols.
All right.
That's our tip for
There
the
we
week.
go. There's our integrative tip of the week. Now,
Use
somebody asked
garlic.
about aged garlic extract, which
You can use it too. But yeah, the studies were just plain, not even aged kyolic garlic. So that even is useful. Then it's cheaper because aged kyolic garlic is a little more expensive.
yeah. I was always taught that the aged garlic wasn't quite as effective.
Yeah, I mean, yeah, in terms of chelation, I mean, aged kyolic cardiovascular benefits are very prominent in terms of the benefits.
Are you equating aged garlic with black garlic?
No, that's different. It's aged
Yeah, it
kyolic
is.
garlic.
Yeah,
That's
okay. I just wanted to be sure that that was the
yes.
case.
Yeah, that's a good point.
Okay. All right. So thank you again, Dr. Nario, for another scintillating tip of
It's
the week.
amazing.
Exciting. I look forward to these. So 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 tonight, everybody, we have a special guest, Lior Sher, Sher. I hope I said that right.
You
Um,
did?
she is the founder and executive director of the Vitamin C Institute for Clinical Integration. It's a global nonprofit dedicated to advancing the science and clinical application and translational education of high dose vitamin C therapy. So we hear a lot about vitamin C therapy. We're going to get the real skinny here. Um, Lior is an attorney, and we won't hold that against her because she's here. She's like our friend Ross Pelton. I take it you're a recovering attorney. Ross is a recovering a pharmacist. I don't know if you know him or not. Lior is a thought leader in redox medicine and integrative clinical strategy. She's widely recognized as the leading authority on pharmacological use of sodium ascorbate. And you're going to tell us the difference between ascorbic acid and ascorbate, correct?
We're going to get to it. Absolutely.
Okay. In cancer, chronic infections, immune dysregulation, regenerative cell therapies, and longevity medicine. She's a sought after speaker and educator. She's a multidisciplinary background in biotechnology, healthcare innovation, and law, translational molecular science, and translating it into practical systems based therapies across integrative, functional, and regenerative disciplines. She's the author of The C Word, Conspiracy, Cover-Up, and Controversy, an expose of and revealing the suppressed therapeutic potential of vitamin C. She directs an annual symposium called C-Posium, CME accredited international conference, and has established a redox-focused training platform, including a 16-hour live certification course. Its clinical framework focuses on redox-targeted strategies to restore mitochondrial function, modulate immunity, improve outcomes across a broad therapeutic spectrum. So, and I'd like to add that Lior's invited me to present at her conference concerning vitamin C and its effect on hormones, and that will be in October. So without further ado, I give you, and forgive her, she didn't know what she was doing at the time, attorney Lior Sher. But she's since seen the light.
Well, I appreciate such a warm introduction, Dr. Clearfield, and good evening, everyone. It is a pleasure to welcome you to this very important discussion, and I'd like to extend my sincere gratitude to Dr. Clearfield for hosting and supporting tonight's session. We're here tonight to examine a molecule that is both foundational and persistently misunderstood, ascorbate, commonly referred to as vitamin C, though its clinical identity and therapeutic scope extend far beyond its conventional classification as a simple antioxidant or anti-scurvy vitamin. Too often, vitamin C is dismissed as basic nutrient, important for preventing scurvy, but little else. In reality, ascorbate functions as pleiotropic molecule, a redox modulator, enzymatic cofactor, and cellular catalyst that supports over 150 metabolic and biosynthetic pathways, including those essential to hormone synthesis, immune regulation, collagen production, and mitochondrial energy generation. And that is just the tip of the iceberg. A critical clarification to make from the outset is this: ascorbate, although interchangeable with ascorbic acid often, even though the terms are frequently conflated in literature and clinical settings, this long-standing confusion has led to important misunderstandings around tolerability, pharmacokinetics, and therapeutic outcomes. We'll explore these fundamentals and clinically significant differences in greater detail later in this lecture. It is worth noting that the original vitamin C therapy protocols, developed by the orthomolecular pioneers such as Dr. Frederick Klenner and Robert Cathcart, relied exclusively on sodium ascorbate. Their work laid the foundation for modern redox and integrative medicine, and it is time for us to return to the biochemical precision that made those protocols so effective. Now, before we dive into the science, a quick but very important note on disclaimers. This presentation is hosted by Vitamin C Institute for Clinical Integration, VCICI, and proudly sponsored by Pure C, a leader in professional-grade sodium ascorbate formulations. VCICI is a nonprofit educational institute committed to advancing clinical knowledge and translational research in vitamin C therapy. Our mission is to provide healthcare professionals with a scientific foundation clinical protocols, and integrational strategies necessary to apply ascorbate safely and effectively across a broad range of therapeutic modalities. Please note that this content presented today is intended solely for educational and informational purposes. It does not constitute medical or legal advice and may include references to third-party sources or products that are not affiliated with VCICI. We strongly encourage all healthcare providers to apply independent clinical judgment, remain in compliance with applicable regulations, and evaluate any off-label uses according to their professional standards and scope of practice. Additionally, while the session may be recorded for the future educational use by the host platform, we respectfully ask that participants do not independently record, distribute, or capture screenshots and audio without prior written permission from VCICI. Finally, any statements made during the session have not been evaluated by FDA and are not intended to diagnose, treat, cure, or prevent any disease. With this out of the way, let's begin. As we transition into the core material, I'd like to begin with a brief overview of today's learning objectives. This session is designed to provide a clear physiological and mechanistic framework for understanding ascorbate's catalytic role in restoring balance, resilience, and therapeutic responsiveness, particularly in the context of integrative, functional, and regenerative care. By the end of this presentation, you should be able to articulate the foundational role of ascorbate in maintaining cellular homeostasis, supporting key biochemical pathways, and regulating multiple physiological systems. Identify clinical patterns in which unresolved oxidative stress and insufficient ascorbate contribute to dysfunction across endocrine, metabolic, neurologic, and immune systems. Explain how ascorbate depletion disrupts core processes involving in cellular repair, signaling, and immune regulation, with direct relevance to chronic and degenerative conditions. Differentiate between ascorbic acid and sodium ascorbate, highlighting, and by the way, the short for it is AA and SA, so highlighting SA enhanced bioavailability, redox stability, and clinical tolerability across delivery methods. Outline practical strategies for maintaining optimal physiological ascorbate levels. Now, I refer a lot to these optimal physiological ascorbate levels, which is somewhat analogous to optimal hormone levels, through oral protocols, and introduce integration points within broader functional and regenerative care plans. This session is intended as scientific foundation for clinical application. Now, for those of you seeking deeper clinical applications, including detailed protocols, sequencing and stacking strategies, safety considerations, potential contraindications, and patient-specific integration, these are covered comprehensively in our extended curriculum. So let's move on. And this slide focuses, this focus of this presentation is really to underscore a critical shift in clinical thinking.
We're not seeing any, Lior, we're not seeing any slides, so.
Did you see the previous slides?
No.
Okay.
Dr. Bill, it's showing up on our end. I don't know if it's on yours.
Okay. How about now?
Yes, we can see it.
Oh, you can
Okay,
see
so
it? Okay, well,
It's
I
probably,
don't know why it's being bumped because I was in share mode. So if something happens again, please alert me, okay?
okay.
So we missed all the initial 3 slides, but I hope that you heard me. But the more important slides are coming up. So the focus of this presentation is to underscore a critical shift in clinical thinking. Ascorbate is no longer an adjuvant. It is a biological catalyst. It activates and amplifies diverse therapeutic strategies and underpins core physiological processes that determine clinical successes. We're not here tonight to dissect every molecular mechanism. That's the purpose of our comprehensive VCICI certification course, launching on August 4th as a 4-part physician-level webinar. That training spans the full clinical spectrum, from infectious disease and regenerative medicine to oncology, hormone optimization, and mental health, including protocol design, sequencing, and therapeutic strategies. But tonight's session takes a focused approach and will explore the science rationale for ascorbate's central role in recalibrating hormone signaling, restoring mitochondrial function, enhancing metabolic resilience, and amplifying integrative therapies through redox regulation. In this webinar, we will address one of the most clinically neglected imperatives, the maintenance of optimal physiological ascorbate levels. This is not a peripheral concern. It's a foundation of terrain preparation, the biochemical readiness that determines whether any intervention can succeed. When ascorbate is deficient or depleted, the biological terrain is compromised. Healing is delayed, hormonal signaling becomes dysregulated, redox balance collapses, and inflammation persists. In states of oxidative stress, whether from chronic infection, environmental toxicity, or metabolic overload, subclinical ascorbate depletion becomes a silent but significant barrier to recovery. Yet few clinicians assess it, and even fewer recognize the cascading impact, including impaired collagen remodeling, hormonal resistance, delayed tissue repair, neuroinflammation, redox imbalance, and reduced metabolic output. This is not about vitamin C as a supplement. This is about ascorbate as a molecular catalyst, the prerequisite for unlocking the efficacy of your most advanced therapies, from hormone optimization to high-dose IVC to ozone, exosomes, peptides, and regenerative biologics. So let's begin by exploring the foundational science behind what we call the ascorbate advantage and how it can transform both your practice and your patient outcome. Let's begin by grounding the discussion in one of the most well-documented yet clinically underutilized role of vitamin C, its involvement in hormone biosynthesis and endocrine regulation. Ascorbate is essential for steroidogenesis and catecholamine's synthesis. It functions as a cofactor for several hydroxylation reactions, including the conversion of dopamine to norepinephrine via dopamine beta hydroxylase and the biosynthesis of cortisol and sex hormones. Without sufficient ascorbate, these pathways become rate limited, particularly under stress or increased metabolic demand. But the role of ascorbate extends beyond synthesis. It also regulates redox balance within endocrine tissue, including the adrenal glands, thyroid, pituitary, and reproductive organs. These systems are highly sensitive to oxidative stress, which disrupts intracellular signaling and impairs hormonal output and feedback loops. One often overlooked aspect is the ascorbate enhanced hormone receptor sensitivity. Even when serum hormone levels are normal, receptor resistance can blunt physiological response, something we frequently observe in cases of adrenal burnout, thyroid resistance, or estrogen dominance. Ascorbate helps reestablish receptor responsiveness by restoring redox tone and membrane function. Importantly, vitamin C is rapidly depleted in the presence of chronic stress, infections, toxin exposure, or inflammatory states, all of which are common in patients with complex endocrine dysfunction. This depletion contributes to downward spiral of hormonal resistance, metabolic instability, and persistent fatigue. Clinically, restoring physiological levels of ascorbate is not peripheral intervention. It becomes critical co-therapy in hormone optimization, detoxification protocol, and adrenal or HPA axis recovery. This sets the stage for how we approach hormone-related conditions, not just with hormone replacement, but with terrain preparation, where ascorbate plays a central role in restoring endocrine resilience and system-wide adaptability. Moving to the next slide, one of the most clinically consequential ways ascorbate supports the endocrine system is through its multi-axis regulatory role across adrenal, thyroid, and reproductive hormones network. Let's explore each one of these axes in turn, beginning with the adrenal glands. The adrenal glands contain the highest concentration of vitamin C per gram of tissue in the human body. A clear evolutionary signal of its critical role, ascorbate is essential for the enzymatic conversion of dopamine to norepinephrine via dopamine beta hydroxylase and directly supports the synthesis of epinephrine and cortisol, two central hormones in stress response. Therefore, it is not a coincidence that ascorbate is often referred to as stress responsive molecule. In fact, Dr. Paul Merrick called it stress vitamin or stress hormone. During periods of acute or chronic stress, intracellular ascorbate stores are rapidly depleted. Without adequate replenishment, we commonly absorb disrupted hypothalamic, pituitary, adrenal, or HPA axis function, reduced stress resilience, and impaired mitochondrial output, and dysregulated inflammatory signaling. Now, vitamin C is not something that we can accumulate or store in our body. It needs to be constantly the uptake needs to be gradual and constant to maintain these ever fluctuating levels. So clinically, this pattern reflects what we refer to as elevated allostatic load, what I referred above, the cumulative burden of stress on the body regulatory system. Allostatic load is not just theoretical, it is measurable contributor to a wide range of chronic diseases, including metabolic syndrome, depression and anxiety, autoimmune disorders, fatigue syndromes, neurodegenerative conditions, cardiovascular disease, and cancer. In these contexts, restoring and sustaining bioavailable ascorbate becomes a clinical cornerstone, not only for the adrenal support, but for buffering the physiological strain driving systemic dysfunction. And these are calls that I get regularly from providers that are struggling maintaining those physiological levels with their critically ill patients, especially those that are treating cancer. So turning to the thyroid gland, vitamin C's influence is often overlooked but highly significant. Ascorbate assists in the conversion of thyroxine, also known as T4, into active form T3 and helps reduce levels of reverse T3, which is biologically inactive metabolite that can interfere with healthy thyroid function, especially during stress or inflammation. In autoimmune thyroid diseases, particularly Hashimoto thyroiditis, ascorbate demonstrates immune modulating effects, including measurable reductions in thyroid peroxidase, TPO, and thyroglobulin, TJ, antibodies. These outcomes are believed to result from
All right, Lior, I accidentally muted you.
Okay.
Sorry about that.
Where did you lose me? Did we cover
Just
the
one
antibodies?
sentence, just the last sentence.
Okay,
Yeah,
so
the antibodies.
Okay, so these outcomes are believed to result from redox-sensitive pathways that support enzymatic function, dampen oxidative stress, and promote immune tolerance, ultimately contributing to improved thyroid stability and reduced autoimmune activity. Lastly, within the reproductive hormone axis, vitamin C plays an essential role in maintaining mitochondrial health, a prerequisite for steroid hormone production, including estrogen, progesterone, and testosterone. Ascorbate also protects hormone receptors from oxidative damage and supports redox-sensitive signaling pathways. These functions are particularly relevant in conditions such as polycystic ovary syndrome, perimenopause, and male androgen decline. Clinically, optimal ascorbate levels are associated with improved hormonal balance, enhanced fertility, reduced oxidative stress in ovarian and testicular tissue, and better symptoms control in age-related endocrine transitions. And it's important to remember These are three systems, the adrenal glands, the thyroid, and the reproductive organs. They're interdependent. Oxidative stress and inflammation disrupt their communication and function. So replenishing ascorbate helps reestablish balance across all three. Clinically, we often see improvement in mood, libido, fertility, metabolic function, and overall vitality, even in cases where conventional hormone therapy has reached a plateau. In summary, ascorbate is not just a supportive therapy, it is central regulatory molecule in endocrine repair, hormone responsiveness, and systemic recovery. As we shift into menopausal transition, ascorbate becomes even more clinically significant, particularly as ovarian hormone production decline and systemic oxidative stress increases. First, consider collagen loss and reduced tissue elasticity, which many patients experience during this time. Estrogen plays a key role in maintaining collagen, but vitamin C is required for its synthesis and stabilization. Ensuring optimal ascorbate levels can help preserve skin integrity, vascular flexibility, and connective tissue strength throughout this transition. Next, bone health becomes a growing concern during menopause. This decline in estrogen contributes to increased bone turnover and the progression towards osteopenia and osteoporosis. Vitamin C supports osteoblasts activity and mitigates oxidative stress in bone tissue, playing a protective role in skeletal integrity. Vitamin C also supports the biosynthesis of mood-regulating neurotransmitters, including dopamine, serotonin, and others, which can be disrupted during perimenopause. By restoring intracellular ascorbate, we often see improvement in mood stability, cognitive clarity, and sleep quality. Now, in our certification course, there's a large segment on mental health, cognitive clarity, and sleep quality. Emerging evidence suggests that ascorbate may also modulate vasomotor symptoms such as hot flashes and night sweats. This is likely due to its influence on vascular tone, nitric oxide regulation, and thermal regulatory control under oxidative stress. And it's important to note, as the ovaries reduce output, the adrenal glands assume the role of producing estrogen precursors. This increased endocrine demand places a higher burden on the adrenal system and, by extension, on ascorbate reserves. Adequate and sustained optimal levels are critical not only for steroidogenesis, but also for buffering the oxidative cost of this hormonal compensation. Clinically, supporting vitamin C status during perimenopause and menopause contribute to greater tissue resilience, improved emotional and metabolic stability, reduced oxidative damage, and more adaptive and graceful hormonal transition. For these reasons, maintaining optimal vitamin C status is not merely supportive, as I mentioned before, it is a foundational requirement for navigating the menopausal transition with physiological resilience and therapeutic success. Now, this slide introduces a core concept that underlies much of what we've discussed, and that what is called redox balance. The body constantly negotiates a balance between oxidants, primarily reactive oxygen species, or ROS, and antioxidants, which defend against their damage. ROS are not inherently harmful. They're produced continuously through normal metabolic activity and are necessary for cell signaling. But when they rise unchecked due to chronic stress, inflammation, toxic exposure, or hormonal disruption, the result is oxidative stress or increased and excessive oxidative stress, which drives dysfunction across multiple systems. To buffer this, we rely on two main antioxidant defense systems. Endogenous system, which is the body produced internally, including glutathione, catalase, and superoxide dismutase, and exogenous antioxidant obtained from food and supplements, such as vitamin E, plant polyphenols, and notably vitamin C. Vitamin C is unique because it contributes to both systems. It acts as direct ROS scavenger and has the ability to scavenge ROS and actually do repair if the damage is not too severe to the tissue. And it helps regenerate other antioxidants, including glutathione and vitamin E. This dual role makes it essential not just for maintaining redox balance, but for restoring it under stress, a distinction that becomes critical when treating patients with hormonal dysregulation, chronic inflammation, or degenerative conditions, or even more critical when you have acute infections, whether it's COVID or sepsis. This is why redox balance isn't an abstract concept. It's a clinical target, and ascorbate plays a central role in modulating it. Now that we defined redox balance, let's take a look what happens when it breaks down and why it matters so profoundly in hormone therapy and chronic disease. When oxidative stress becomes chronic, either due to excess ROS or diminished antioxidant capacity, usually it's both because one drives the other, it initiates a cascade of cellular dysfunction, DNA damage, protein misfolding, lipid peroxidation, and mitochondrial exhaustion. Clinically, we see the impact in patients who present with fatigue that doesn't resolve with rest, hormone resistant, even with appropriate replacement or optimization, thyroid dysfunction, autoimmune flares, and mood instability, poor detoxification, delayed wound healing, elevated inflammatory markers, cardiovascular dysfunctions, including endothelial damage and dyslipidemia, and in more advanced states, progression towards cancer initiation and tumor microenvironment instability. Often these patients exhibit a constellation of persistent nonspecific symptoms that defy standard diagnosis or treatments. So this is where vitamin C becomes a clinical tool, not just wellness supplement. It supports, as I mentioned before, mitochondrial functions, regenerates key antioxidants like glutathione and vitamin E, and neutralizes free radicals before irreversible damage occurs. And I talk, in our certification course, we bring quite a bit of literature to light, case studies, published studies, and examples. I mean, and I will never forget the one when I had a surgeon call me with a problem that he just performed a surgery on. It was a breast surgery, breast reduction. It was a secondary surgery on that patient, and she was about to lose her nipples. They were getting black and necrotic. And so it's all about also timing. And remember what I said, maintaining those physiological levels. So had this patient been prepared for the surgery, it would have unlikely to have happened, because that's what we discussed, the preparation of terrain, because any kind of a medical intervention, it causes increased ROS and therefore depletion of ascorbate levels. So timing and the severity of damage is very critical, also very relevant when we talk about sepsis. In one of our conferences, both Dr. Paul Merrick and Pierre Corey discussed it. Timing is everything. So even more critically, I think I mentioned, ascorbate modulates redox signaling itself, regulating hormone receptor sensitivity, cytokine expression, and gene transcription pathways involving in repair, detoxification, and immune surveillance. So if we don't directly address oxidative stress, particularly in complex treatment-resistant hormone or chronic disease cases, we risk overlooking the upstream mechanism that may be sabotaging patient progress. That is why in the next slide, we'll explore how strategic ascorbate integration, both oral and IV, can reestablish redox balance and significantly improve therapeutic outcome. Now, I emphasize here this combined approach, and I talk about it extensively in that course, because without the one, if you just, most providers just want to focus on IV, but as you delve deep into the science, you will find that even with some of the most acute infections, you don't necessarily need to immediately go to IV. In fact, you can often neutralize whether it's viral or bacterial infections, sometimes as quickly as 1 hour with pharmacological levels and protocols of oral ascorbate. So let's now zoom into the mitochondria, where ascorbate plays a pivotal role, yet often under-recognized role in clinical recovery and resilience. As the powerhouse of the cell and the primary site of ATP production, mitochondria are both producers and targets of reactive oxygen species. And while a certain baseline of ROS is necessary for cellular signaling, excess oxidative stress, especially in chronic inflammation, infection, and toxin exposure, leads to mitochondrial collapse, impaired energy metabolism, and redox-driven inflammation. Ascorbate is uniquely positioned to defend and restore mitochondrial function. It accumulates inside the mitochondria, where it scavengers ROS, protects lipid membranes, supports electron transport, and regenerates critical antioxidants, as I mentioned before, both glutathione and vitamin E. Now, when we talk about the cancer care, we get into it a little bit deeper, but here we're just kind of providing an overview. Clinically, mitochondrial dysfunction is central to fatigue and fibromyalgia, neurodegenerative diseases like Parkinson's and Alzheimer's, cognitive decline and mood disorders such as depression and anxiety, hormonal dysregulation and metabolic inflexibility, muscle wasting and poor exercise recovery, and age-related macular degeneration and other vision loss syndromes. And importantly, these same tissue, brain, endocrine organs, retina, and heart have the highest mitochondrial density and the highest vulnerability to oxidative stress. And when I covered age-related vision loss, I bring some very important examples and background that I have specifically in AMD and what we've done to often reverse or halt the progression, especially of the dry stage of this vicious binding disease. So when we restore ascorbate to therapeutic, not just nutritional levels, we protect mitochondrial integrity and recalibrate energy metabolism at the root. This isn't just about boosting ATP, it's about restoring function in the tissue that define quality of life. As we've just seen, mitochondria are more than just energy producers. They serve as central hubs for cellular signaling, metabolic integration, and immune regulation. Beyond ATP production, mitochondria governs how macronutrients are metabolized, including glucose oxidation, beta oxidation of fatty acids, and amino acid catabolism. They also influence inflammatory tone, redox balance, steroidogenesis, and apoptotic signaling, all of which are essential in maintaining systemic homeostasis. When mitochondrial function is compromised, whether by oxidative stress, environmental toxin, micronutrient insufficiency, chronic infections, or aging, we observe downstream of consequences such as insulin resistance, neuroinflammation, and neurodegeneration, chronic fatigue syndromes, hormonal dysregulation, impaired tissue repair, and immune suppression. And this is where ascorbate becomes clinically indispensable, not just as a free radical scavenger, but as a direct mitochondrial cofactor and redox regulator. And its roles include stabilizing mitochondrial membranes, protecting components of the electron transport chain from ROS-mediated damage, recycling glutathione and maintaining NAD, NADH redox balance, supporting adaptive redox signaling required for metabolic flexibility and stress resilience. So in short, vitamin C supports mitochondrial integrity and signaling plasticity, which are foundational for endocrine balance, immune coordination, and metabolic restoration. This brings us to the next layer of discussion, how ascorbate regulates metabolic function at the systemic level, influencing nutrient handling, insulin sensitivity, and inflammatory resolution across organ systems. So let's explore that. So as we begin, to exploring this critical role of vitamin C in the brain health, we turn first into the central nervous system, where ascorbate exerts profound but often clinically unrecognized effects. After the adrenal glands, the brain holds the second highest concentration of vitamin C per gram of tissue in the human body. This alone signals its indispensable role in neurological health and function. Vitamin C is one of the few antioxidants capable of crossing the blood-brain barrier, where it's actively transported into neurons via sodium-dependent vitamin C transporter 2, or is known as VCT2. Once inside, its impact is multifaceted, supporting neurotransmitter synthesis, protecting against oxidative damage, and regulating neuronal signaling. First, it's essential in the synthesis of key neurotransmitters, including dopamine, norepinephrine, and serotonin, all of which regulate mood, attention, memory, and emotional processing. These mechanisms are clinically relevant across a wide range of neuropsychiatric and neurodegenerative conditions, including depression and anxiety, schizophrenia and psychosis, where glutamate toxicity, redox imbalance, and low ascorbate levels contribute to pathophysiology, PTSD, and trauma-related dysregulation, Alzheimer's and Parkinson's, multiple sclerosis, post-COVID neuroinflammation, cognitive decline associated with chronic oxidative stress or hormonal shifts. In these states, oxidative burden, mitochondrial dysfunction, and neurotransmitter imbalance converge when creating a feedback loop that perpetuates dysfunction. So one leads to another, and the vicious cycle continues. And again, vitamin C is the catalyst that can interrupt this. So it's uniquely positioned to interrupt the cycle, supporting both neuroprotection and neurorepair. And again, it's not simply about avoiding deficiency, it's about achieving physiologically optimal and functional levels that are sustainable, that meet the metabolic demands of a stressed or dysregulated brain, which is especially true in cases of trauma, neuroinflammation, or endocrine brain axis disruption. As we zoom out of the brain and endocrine system, let's examine how ascorbate influences metabolic health and at the systemic levels. Vitamin C functions as direct cofactor for carnitine biosynthesis, a molecule essential for transporting long-chain fatty acids into the mitochondrial for oxidation. Without adequate ascorbate, carnitine synthesis decline, fatty acid transport is impaired, and mitochondrial energy production suffers. This makes vitamin C indispensable for fat metabolism and ATP generation, particularly in insulin-resistant, inflamed, or energy-deficient states. Beyond energy metabolism, ascorbate modulates redox-sensitive signaling pathways involving in insulin sensitivity and glucose uptake. It also protects pancreatic beta cells and insulin receptors from oxidative injury, both of which are highly susceptible to ROS metabolic disorder. At therapeutic levels, ascorbate helps mitigate the core features of metabolic syndrome, including visceral adiposity, insulin resistance, hypertriglyceridemia, and chronic systemic inflammation. It also plays a role suppressing advanced glycation end products, AGEs, harmful compounds that accelerate vascular aging and metabolic decline. So growing clinical evidence support vitamin C role in managing type 2 diabetes, dyslipidemia, non-alcoholic fatty liver disease, and obesity-associated cognitive dysfunction. In each of these, the pathology involves oxidative stress, mitochondrial dysfunction, and metabolic inflexibility. So you're beginning to see a pattern here, all of which are targetable through sustained bioavailable ascorbate therapy. Now that we've established vitamin C pivotal role in redox regulation, endocrine signaling, mitochondrial integrity, and metabolic health, it's essential to highlight a key clinical insight that remain underappreciated even among the most experienced practitioners. Not all forms of vitamin C are clinically equivalent. And this is what Dr. Clearfield started in the beginning. Am I going to cover it? This is probably the most critically misunderstood and misapplied therapy, even as I said, in the most experienced practitioners. Understanding the biochemical and therapeutic distinction between ascorbic acid and sodium ascorbate is essential for optimizing efficacy, minimizing adverse effects, and improving outcomes, especially in patients with chronic illnesses, metabolic syndrome, GI sensitivity, or elevated oxidative stress, which most of us experience pretty much on a daily basis. This distinction becomes especially critical as we move beyond general nutritional support into targeting therapeutic applications such as IV infusions, surgical applications, regenerative protocols, and high dose, high frequency, both in oral and IV in integrative oncology. In these contexts, the form of ascorbate or the form of vitamin C selected directly influences clinical performance, not only through the difference in tolerability, but in bioavailability, tissue compatibility, stability, and energetic demand. From a molecular standpoint, form dictates pH, oxidative stability, transport mechanism, which is very important. We'll talk about it in just a little bit. Redox cycling and redox cycling. While now both AA and SA, and again I'm referring to AA as ascorbic acid, SA as sodium ascorbate, ultimately deliver the ascorbate ion. Only sodium ascorbate incorporates a sodium ion, a prerequisite for active transport via SVCT1, which stands for sodium-dependent vitamin C transporter. So again, it has the sodium ion, which is prerequisite to transport vitamin C via sodium-dependent vitamin C transporter 1 and SVC2, the sodium-dependent vitamin C transporters. And in contrast, AA relies on passive glut transporters, which are slower, less efficient, and more vulnerable to disruption in energy-depleted or inflamed tissue. Moreover, AA must be buffered and ionized intracellularly, increasing cellular energy demanding and potentially straining redox systems, especially in patients with mitochondrial compromise or malignancies. Sodium ascorbate being pre-ionized and pH neutral bypasses this burden. It's more stable in plasma, resists oxidation, and better supports sustained therapeutic dosing. Most importantly, SA enhances the ascorbate glutathione NADPH triad, improving glutathione recycling and maintaining intracellular redox balance. In redox-sensitive conditions such as cancer, neurodegeneration, immune dysfunction, or hormonal resistance, this choice can shape therapeutic outcomes. So let's begin with examining the limitation of ascorbic acid, followed by the distinct clinical advantage of sodium ascorbate. Ascorbic acid, through the widely available, present notable limitation across several domains. Its naturally low pH, typically in the low 2s, often provokes irritation, tissue damage, and discomfort in GI, mucosal, and vascular systems, rendering it less suitable for sensitive patients or high-dose applications, where obviously by definition are required in cancer, not just high dose, but high frequency. Even when buffered, the pH commonly remains in the low 5s as the range for that compromises tolerability and by extension clinical outcomes, because if the patient cannot tolerate it, it's very difficult to obtain the required PPC levels to reach selective cytotoxic results. Chemically, AA is inherently unstable, oxidizing rapidly in plasma or solution unless carefully protected from heat, light, and oxygen exposure. That is why you have very short shelf life on AA solutions. Once absorbed, it relies on passive GLUT transport and intracellular conversion to the ascorbate anion, a process that consumes additional cellular energy, and it's easily disrupted in conditions of oxidative stress or impaired mitochondrial function. In contrast, SA, sodium ascorbate, is naturally buffered mineral salt with a neutral pH range of approximately 7.4 to about 7.8, making it markedly more biocompatible across all delivery routes. Its chemical structure confers greater plasma stability, and critically, the presence of sodium ion facilitates, as I mentioned earlier, active transport via SVCT1 and SVCT2, a significant advantage in patients experience elevated oxidative stress, tissue hypoxia, or mitochondrial dysfunction. This active transport mechanism supports more efficient intercellular uptake and enhances redox cycling, particularly the regeneration of glutathione and one of the body's essential intracellular antioxidants. These differences are not merely academic. These are clinically actionable. In oncology, for example, the tumor microenvironment is often both acidified, energy depleted. The use of ascorbic acid in such setting may further contribute to extracellular acidification, potentially undermining therapeutic goals and tissue tolerance. In contrast, ascorbate, with its pH neutral and sodium coupled transport, offers superior biocompatibility and therapeutic precision. Similarly, in chronic diseases protocol, detox, and metabolic repair, SA energetic efficiency helps reduce systemic strain while enhancing the efficacy and sustainability of treatment. So in sum, while both vitamin C forms ultimately deliver ascorbate, ascorbate ion, their pharmacological behavior in the body differs significantly. Selecting the appropriate form, because AA does not deliver directly sodium ions, especially in clinical contexts where dosing, bioavailability, and tissue sensitivity and frequencies are critical, it's essential to optimize therapeutic outcome with the most bioavailable form that also increases tolerability and enhanced clinical outcomes. So again, in intravenous therapy, SA offers superior tolerability, as I mentioned, in comparison to AA, significantly reducing the risk of phlebitis, peripheral vein sclerosis, GI upset, and metabolic acidosis, all common concern with high dose and repeated infusions. SA enables more reliable uptake through a sodium-dependent SVCT1 and 2 transporters, even in redox-compromised or energy-depleted states, and more effectively supports glutathione recycling and antioxidant regeneration, enhancing redox resilience during oxidative stress. In surgical and localized tissue applications, and for those that are interested in it, there's a great recording from our 2023 symposium. It's available on our website, especially in dental surgeries, and hopefully we will be sharing some cosmetic surgeries in this coming symposium in October, how it is implemented intraoperatively to enhance tissue regeneration, reduce microbial burden, accelerate healing, etc. So SA can be used intraoperatively or injected directly into joints or tissue planes. In fact, that's one of the conversations I just had recently with Dr. Schallenberger, without provoking irritation or disrupting enzymatic healing cascades. Its pH neutrality and tissue compatibility makes it ideal for use alongside biologics, regenerative agents, and remodeling protocols in integrative surgical care. In oral protocol, SA provides improved GI tolerance. And by the way, there's a whole section that I go over utilization of ascorbate in dentistry, both for oral and systemic healthcare, for mitigating and resolving periodontal disease cavitation-related infections, hygiene protocols, as well as some others. And so can be widely and easily used in the oral mucosa, unlike AA, which you would never want to use on your teeth or in your mouth. It can erode the enamel. It can cause significant damage and discomfort. In fact, I had one biological dentist that once told me that he saw a patient that came in for restoration, but examining his mouth, there was pretty much nothing left to restore, and that is because that particular patient was using ascorbic acid extensively. So again, it's significantly less irritating to the gut lining, oral mucosa, or any tissue, which is especially important also with patients with gastritis, IBS, or mucosal inflammation. It is buffered, pH neutral, and ensures steadier absorption, sustainable levels, supports better compliance from the patient's, better experience from the patient perspective, and preferred in long-term therapeutic regimens where cumulative tolerance and metabolic impact matters. The clinical utility of vitamin C isn't just about delivering the ascorbate molecule, but delivering it in the correct form. I already mentioned it, but this is kind of an overview again. So again, we talked about ascorbate, AA versus SA ultimately yield both of them the ascorbate ion, but only SA provides the sodium-bound pH neutral form, which confers key therapeutic advantages in transport, tolerability, and redox behavior. So I think we pretty much already touched on these points. So we'll just go to the next slide. So now let's discuss how vitamin C's antioxidant role extends far beyond general immune support. It targets specific redox-driven mechanisms implicated in acute infections and chronic inflammatory syndromes. In infectious disease, from flu to sepsis to COVID-19, and I have so many examples I can share with you that we assembled over the years, and especially during the pandemic. Vitamin C mitigates the downstream effects of immune overactivation and oxidative stress, mitochondrial dysfunction, cytokine surges, and endothelial injury. It supports neutrophil clearance, modulates ROS, and promotes immune resolution. Importantly, vitamin C also regulates the net formation, a key mechanism in both acute infections and autoimmune flare-ups. Dysregulated netosis is a major driver in vascular injury and in sepsis, COVID-19, long COVID, and other conditions. And I talk about it again extensively. There's a section we talk about the neutrophils and the net formation and what happens with the dysregulation netosis, how it relates to the dysregulated or excessive ROS, one leads to another, and the sequence of thing, and what happens to ascorbate as the result of it. And ascorbate again acts as a catalyst to regulate all of this, all of these situations. So in spike protein related injuries, for example, whether from viral remnants or vaccine-induced immune responses, vitamin C helps reduce endothelial inflammation and counteract the persistent immune activation seen in many post-viral syndromes. And in long COVID, which often involves chronic oxidative stress, mitochondrial dysfunction, and persistent immune dysregulation, high-dose or sustained vitamin C protocols, oral and IV, can help restore redox homeostasis and improve systemic resilience. Now, you will be amazed how quickly you can actually obtain these results with, as I said, pharmacological oral protocol. And I've seen so many protocols that just throw in vitamin C because it sounds good, it sounds sexy, because it's the word of the moment, especially since the COVID pandemic. But precision matters, and so are the individualized targeted protocols, understanding the each individual's patient's pre-existing conditions, their levels of toxins, their levels of ROS, what causes it, and there's a long list of contributing factors. And in fact, at the end of this slideshow, I will share with you some additional resources that talk extensively about the contributing factors and what actually happens and the science behind it. So this is not all just theoretical. These antioxidant and immunomodulatory effects have been leveraged in protocols going back to 1940s, actually since 1930s, and the history does matter. In fact, it started with Dr. Klenner, who published 28 scientific papers and had 100% success in curing polio. This is all documented, and it was all done with high-dose ascorbate. Again, this is all covered in our long certification course. Now let's take a look on vitamin C plays a multifaceted role in immune regulation and pathogen clearance. It first attenuates inflammatory mediators, specifically IL-6, TNF-alpha, and C-reactive protein, which are commonly elevated during acute infections, chronic inflammation, and cytokine storms. It also modulates innate immunity by supporting neutrophil clearance and accelerating the resolution of nets or neutrophil extracellular traps. This process is essential to prevent collateral tissue damage and mitigate autoimmune activation. The dysregulation of nets is especially relevant in COVID, long COVID, and other autoimmune-linked conditions where excessive net formation amplifies pathology. So beyond immune modulation, vitamin C directly impairs viral, bacterial, and fungal replication via redox disruption, lysosomal acidification, and metabolic inhibition. Clinically, this translates into broad spectrum relevance against pathogens such as the herpes virus, HSV, Epstein-Barr virus, respiratory pathogens, UTIs, and even chronic infections like Lyme disease. Vitamin C also strengthens mucosal and epithelial barrier integrity by promoting collagen synthesis and cross-linking, a vital mechanism in wound repair, gut health, and urogenital defense. We have incredible examples to bring on UTI, and it can be in those women that are suffering from chronic UTI with the oral protocol that can be neutralized within less than an hour. And symptoms are resolved very quickly. And if they maintain their optimal levels, it is unlikely for them to experience another flare-up, something that you do not see with standard antibiotics. Finally, it regulates both oxidative and nitrosative stress, supporting infection resolution while minimizing systemic inflammation. These properties make it indispensable therapeutic tools conditions ranging from measles, mumps. Measles are very, is the latest bug that they trying to push the vaccine about. So measles, mumps, and herpes to modern infections, burdens like SARS-CoV-2, long COVID, and spike protein-related syndromes. Although most clinicians are familiar with oxidative stress driven by ROS, it's important to briefly acknowledge nitrosative stress, a parallel process involving reactive nitrogen species, particularly peroxynitrate, which forms from the reaction between nitric oxide and superoxide. This contributes to mitochondrial dysfunction, protein nitration, and persistent inflammation seen in conditions like neurodegenerative diseases, chronic pain syndrome, autoimmunity, and cancer. Vitamin C is unique in that it not only scavenges ROS, but also helps neutralize RNS, restoring redox equilibrium and preventing nitrosative injury to tissues and signaling systems. Now let's take a peek into how vitamin C plays an indispensable role in regenerative medicine due to its structural and regulatory functions at the cellular and extracellular levels. As a cofactor for prolyl and lysyl hydroxylases, vitamin C is essential for collagen synthesis and extracellular matrix stability, supporting wound healing, scaffold integration, and structural remodeling. It impacts fibroblast activity, and collagen cross-linking is foundational in tissue regeneration. It enhances mesenchymal stem cell proliferation and differentiation, and drives epigenetic reprogram via TAT enzyme activation, critical for optimizing tissue-specific lineage, commitment, and engraftment success in autologous or allogenic cell therapies. Vitamin C also improves the stability and bioactivity of exosomes by preserving membrane lipid integrity and protecting mRNA and protein payloads from oxidative degradation. This safeguards their therapeutic signaling and enhances downstream efficacy in regenerative applications. Moreover, vitamin C downgrades pro-fibrotic and pro-inflammatory cytokines that I mentioned before, therefore minimizing fibrotic scarring and promoting a regenerative rather than degenerative healing trajectory. It also exhibits broad-spectrum inhibitory activity, functioning as an antimicrobial, antiviral, antifungal, antitoxin, antipoison, anti-inflammatory, and potent antihistamine agent. Before we started this session, Dr. Clearfield and I had a quick exchange on an issue that he experienced today in his practice, and I can bring you a myriad of examples how literally we saved lives with a quick intervention with ascorbate in life-threatening situations. These properties are critical not only in chronic wounds and biofilm-laden environments, but also in acute infections, as I mentioned, sepsis, COVID-19, post-viral syndromes, etc., by reducing microbial load, neutralizing toxins, stabilizing mast cell, and dampening hyperinflammation. Ascorbate helps restore immune surveillance and enables regenerative healing to proceed unimpeded. At the mitochondrial level, we already covered that. So for clinician practicing functional, integrating, and regenerative medicine, ascorbate is not just an antioxidant. It's a regenerative catalyst that optimizes biologic therapies, cellular resilience, and post-procedural outcomes. Now, for those of you that would like to learn a little bit more on regenerative properties on vitamin C, watch my recent webinar I presented to the American Academy of Stem Cell Physicians, and that is available on our homepage at vcici.org. Here we take a focused look on vitamin C role as a selective pro-oxidant. Now, we don't have the time today to go in depth because that requires several hours. It is a therapeutic property often unappreciated and underutilized and actually misapplied in integrative oncology. While vitamin C is widely known for its antioxidant effects at physiological levels, at pharmacological doses, particularly when administered IV, it shifts to a pro-oxidant role. This effect is mediated by the generation of hydrogen peroxide in the extracellular space through phantom chemistry, in which redox active metals like iron catalyze the oxidation of ascorbate. Tumor cells and pathogens frequently accumulate excess iron to support rapid proliferation, creating a redox-active environment that enhances this oxidative reaction. At the same time, these cells often exhibit compromised antioxidant defenses, including low levels of catalase and glutathione peroxidase. This makes them particularly vulnerable to oxidative stress, while healthy cells are protected by robust antioxidant systems. I get these calls also on a daily basis with physicians who are providing cancer support therapy with high-dose IVC. And for those that are highly experienced in integrative oncology, they will tell you specifically that in terms of cancer efficacy in integrative oncology, in terms of efficacy, a high-dose IVC comes first. I'm not advocating by any means for monotherapy. I'm just telling you in terms of efficacy, but that is if it is done right. I see every imaginable mistake happens on a daily basis with a call I just received today from a physician who was administering the therapy and at the same time administering glutathione. So there's all these things that we need to look out for. This differential susceptibility creates a powerful therapeutic window. The resulting oxidative burst as a result of Fenton reactions selectively damage malignant and infected cell through DNA damage, lipid peroxidation, ATP depletion, and apoptosis without harming normal tissue. Beyond its direct cytotoxicity, vitamin C also remodels the tumor's microenvironment by dampening chronic inflammation, restoring immune surveillance, enhancing oxygenation, reversing hypoxia and supporting vascular normalization, and increasing radiosensitivity. As a result, HDIVC or high-dose vitamin C acts not only as targeted oxidative stressor, but also as a synergistic agent, improving conventional medicines such as chemo and radiation, reducing toxicity, supporting overall treatment outcomes. And it's also foundational to integrative oncology, where stacking, sequencing, and proper delivery of vitamin C is key to efficacy. So what I mentioned before, you need to understand how to properly sequence them with other therapies, timing, hierarchy, and what you can stack it with or what you should not potentially. To explore this, including synergistic combination with, as I said, conventional therapies or complementaries, whether it's ozone or ALA, alpha lipoic acid, and more, please refer to our certification course. Next. As we move from clinical application to implementation, it's essential to address the practical safety. So let's just talk a little bit about that. Particularly when administered, as I said, IVC. This triphasic approach, oral preloading, IV repletion, and sustained maintenance, offers both therapeutic efficacy and excellent safety profile when executed with precision. High-dose IVC, especially with ascorbate, is extremely well tolerated by most patients. But safety doesn't come from the molecule alone. It comes from appropriate screening, clinical insight, and individualized protocol, including not only dosing, frequency, rate of administration, duration of the actual treatment, and then the long-term maintenance protocol. But to start with, the first and the most critical requirement is G6PD screening. Patient with glucose 6-phosphate dehydrogenase or G6PD deficiency lack the enzymatic capacity to regenerate reduced glutathione efficiently, making them more vulnerable to oxidative stress. When exposed to high-dose vitamin C, this can lead to hemolysis due to inability of red blood cells to buffer the oxidative burst that we just talked about. For this reason, G6PD testing is a non-negotiable tool or screening before initiating any high-dose IVC. Now, when we talk about high-dose, you need to understand that I primarily deal with integrative oncology clinics from all over the world. The dosing can range or start from 50 grams and sometimes go to as high as to 300 grams in 24 hours. And if you're giving anybody anything more than 25 grams, G6PD clearance is an absolute must. Now, it's important to note that deficiency, now somebody just called me, well, what about high levels of G6PD? High levels is not a problem. What we don't want to see is low levels. It does, it's not frequently that you will see a patient with G6PD deficiency, but it does happen. And in those cases, it's not necessarily a contraindication, but you just need to start low and slow. What does it mean? In some cases, patients with mild variants may tolerate gradual titration. So what we've seen over the years, those patients that have G6PD deficiency, you can actually get them to normal levels in time, but you need to start gradually, you may need to start them with 20 or 25 grams and then slowly titrate them up. And believe it or not, it is not a permanent condition. They get then to normal levels, and you can proceed accordingly with the levels that they require to get to the peak plasma concentration in order to achieve those cytotoxic levels. So next, renal functions must be evaluated. Ascorbate is renally excreted, and while high dose IVC has not been linked to kidney stones, now that's another misconception I discussed both in my book and the certification course. With normal, it is not correlated to oxalate kidney stones in normal renal function patients. Impaired clearance can lead potentially to oxalate accumulation. So adequate hydration and routine monitoring are essential here. Iron status is another important consideration. It is vitamin C increases iron absorption and mobilization, a benefit in many cases, but a risk in patients with hemochromatosis or iron overload. In such cases, lower dosing or oral ascorbate through the CYP 7-7 protocol we'll discuss in the next slide or so. May offer a much safer alternative. Needless to say that if you have a stage 4 cancer patient, you're not going to achieve those levels with oral protocols. So in the integrative clinics or with the integrative clinics that I work with, they do get these type of patients and they still get the high doses that they require, but they're just closely monitored. It is also important to assess for a history of fluid overload or kidney stones. We already mentioned that, but fluid overload conditions like congestive heart failure, malignant ascites, or advanced renal diseases that I mentioned earlier. Again, these are not necessarily contraindications, but you have to watch and monitor these patients closely. Now, again, in the oncological settings, most of these patients that arrive there, they're already stage 4, and therefore they're going to have malignant ascites. And these patients often receive an excess of 150 or even 250 or sometimes 300 grams in 24 hours, but they're closely monitored. So the bottom line, when these safety considerations are addressed upfront, G6PD, kidney function, iron load, fluid intolerance, HD-IVC becomes a highly safe and powerful clinical tool. And let's take a look at the CYP 7-7 protocol. And so what does it really stand for? Is that you want optimal and gradual distribution from your waking hours to your bedtime, 7 to 7, basically. We want to make sure that those levels, just like with hormones, and I mentioned that analogy in the beginning, you want to maintain stable, sustainable, and optimal levels, which is very challenging with patients that are critically ill, because studies have demonstrated that critically ill patients are in constant state of deficiency or sometimes depletion. So in order to avoid that, we recommend this protocol, which is very practical. And as I mentioned earlier, not all patients require IV vitamin C. So don't be quick to jump into it, because I can bring you so many examples with patients with all kind of situations, and especially infections, that we were able to resolve very quickly with oral protocol, even with elderly patients with pre-existing comorbidities such as cancer, and they had COVID, and it was something that we were able to reverse and resolve within hours. So, however, every patient requires sufficient tissue ascorbate levels, and that's where oral protocol becomes indispensable. So what I'm sharing with you today is mostly for maintenance, but this is also especially true in chronic and complex conditions, which I mentioned. Physiological ascorbate levels are chronically depleted in these type of situations due to oxidative stress that is increased, infection, toxic burden, and metabolic dysfunction, especially in aging patients. In these cases, the oral sodium ascorbate becomes daily clinical tool for maintaining redox homeostasis, preventing flare-ups and supporting regenerative immune functions. Now, remember, we talked about mitochondria and chronic fatigue. I get these calls and examples and feedback from both clinicians and their patients all the time. And recently it was a gentleman who was in his late 80s dealing with cancer, truly just did not want to get out of bed, had no energy and no, so to speak, joie de vivre, so to speak. So there was really no juice, so to speak, left anymore for him to fight it. And when they put him on this oral protocol, he was ready to get started with dancing. I'm kidding you not. These are the reports that I get from our clinician. So this is why we developed the 727 protocol, a targeted real-world oral dosing system designed to meet the needs of functional and integrative practices and their patients. So for maintenance, begin with 1 teaspoon, which is on the average 4 grams daily. Now, we don't measure ascorbate to the accuracy that you would have to measure a drug. Okay, the body will determine the levels that it needs on that particular day, because the fluctuations is a daily occurrence depending on the oxidative stress, whether they slept well, whether they overworked themselves, traveled, and a myriad of other scenarios. So this is appropriate for relatively healthy individuals and supports long-term immune balance, hormonal regulation, skin health, collagen integrity, energy, and redox status. So I really call it like your invisible bubble. You want to walk into the airport and everybody is hacking and sneezing, or maybe a hospital setting, and you want to make sure that you have a natural defense. This is what you do in order not to catch whatever bug that is. And if you do, you are going to experience maybe a lighter version of it. And so that is, again, maintenance for a relatively healthy individual. Now, if we're dealing with acute presentations, whether it's viral, bacterial, inflammatory, post-procedural, like surgeries, this protocol shifts. Now we start with a 1 teaspoon loading dose, which is very similar to what we do like with an IV. We have a loading dose. Follow with another dose every 2 to 4 hours until gut tolerance. Once the threshold is reached, titrate it down gradually. The most common mistake that both providers do, or not communicating it to their patients, or patients are non-compliant and not doing it. You can resolve symptoms so quickly with it, especially if it's a medical grade product. But they discontinue the use of it upon resolution of all symptoms. So it's very important to note that continue a lower dose for at least 72 hours post resolution of all symptoms, or whatever that is, bacteria, virus, will continue to proliferate. And if you're not doing it, you will not be able to prevent rebound or relapses, which are especially prevalent and critical in chronic conditions such as UTI or shingle virus. For therapeutic protocols, especially high dose or chronic use only pure medical grade sodium ascorbate. Your patients will not be able to tolerate these protocols or achieve the necessary levels with AA, let alone if there's any additives, and most of them do, from excipients, preservatives, or flavoring agents. This will compromise the clinical effects. So you want effervescent and additive containing formulations that will absolutely compromise it. And I received calls from practitioners that noticed that there was all kind of preservatives that in commonly used vitamin C's. So for patients unable to tolerate oral dosing, so let's say you had a non-compliant patient, or when tissue saturation is urgently needed, IV sodium ascorbate remain an excellent adjunct. And in some situations, when it's a life-threatening situation due to some kind of toxicity, allergic reaction, poison, you might also be doing injectables, IM or subcutaneously. So we talk about it at length as well. So we are nearing the end here. I think we went quite a bit over time, but I wanted to equip you with additional resources that are available through VCICI. As I mentioned to you earlier, I only teach group webinars. These are live webinar, 4 sessions each, 4 hours each, twice a year. The last certification course for 2025 is starting on August 4th. It is at 6 p.m. Eastern. And it is a live webinar, so you don't have to fly, you don't have to stay at a hotel, but you do have to be available via live video Zoom. In addition to that, we have the symposium. This is a very sought after scientific summit, and it is going to be held October 24 and 25th in Clearwater Beach, Florida. The registration is open. Our discounted rooms are almost sold out. So I encourage you to review the information on our website, the agenda, the extensive schedule that we just published last week. It is CME and CE accredited sessions. So if you choose to get those, these are available. And lastly, for both clinicians and your patients, I have been asked to write this book over a decade, and it's finally available. This is your foundational resource, both before the course, and I strongly suggested that if you're going to take the course and you are going to get overwhelmed with it, if you don't want to be in that situation, read the book beforehand. It will lay out the foundation. It will be easier to follow, and then a resource after you've taken the course to kind of refresh your recollection. In addition to it is an excellent roadmap for your patients that are seeking integrative, especially cancer treatment modalities, and you don't have the hours to spend with them to educate them. This answers many, many questions and gives them tips and what they can do at home. So no, that book does not provide you with all the protocols because, again, you need to understand the pharmacokinetics, the pharmacodynamics, the biochemistry, and the science behind vitamin C, so you don't implement one-size-fits-all approach, because that hardly ever works. And that is what we cover in that foundational certification program that most of our providers actually repeated several times because of the amount of information shared. But in order not to do that, again, read the book first and then come join us at the symposium. I'll share a little bit more about it in a moment. Here you can see the dates, so feel free to take a snapshot on that, but it's also available on the vcici.org website under certification. It will give you all the dates and times and how to register. And if you're a VCICI member, you do receive discounts on our certification course as well as the symposium. Now, the symposium, as I said, the schedule was just released last Friday. It's taking place on the beautiful beaches of the most #1 beach town in the United States, Clearwater Beach, right on the Gulf of America. This year's speaker lineup is truly exceptional. Join us, our world-renowned ozone medicine pioneers like Dr. Frank Schallenberger and Dr. Robert Rowan, who will be presenting the latest clinical breakthroughs in synergy and the synergy between ozone therapy and ascorbate, including new application of ozonated glycerin, OG, or I call it OMG, oh my God, combined with sodium ascorbate in regenerative and oncological protocol. And you'll also hear from our esteemed host, Dr. William Clearfield, who will explore much deeper vitamin C regulatory role across endocrine pathways and deeper dive into what we began here today. Again, the lineup is extensive, so you can look it up on the website. We will finish that amazing, or actually we will start the Friday evening with an amazing sunset welcome reception right on the beach. Perfect way to unwind, meet and greet, discuss science and everything else. So again, registration open. Now, lastly, for those of you that are seeking resources with medical grade.
So cholesterol gets used or activated to turn into pregnenolone using a lot of vitamin C. So every hormone patient that I have, I make sure I put vitamin C on. But the caveat that you did today, I'm going to change them now to sodium ascorbate because I'm using sometimes ascorbic acid. But for any clinician out there who's using hormones, maybe that's probably a foundational supplement that everybody should start with. I mean, as you mentioned, adrenals kind of like uses a lot of this. It is the #1 organ that probably consumes that. So thank you for reiterating that to our audience.
No, and I appreciate the feedback. And not only that, there are studies to demonstrate. And again, when I talk about cardiovascular health and epithelial health section in this 16-hour certification program, I expand into it. It actually, there are studies to demonstrate that it lowers the bad cholesterol. There are also studies to demonstrate that it lowers high blood pressure, because that's another misconception. And I talk about it in my book because I get these calls all the time. And you need to understand, again, the biochemistry. We're talking about sodium ion, not sodium chloride. It's not the same as table salt. And I get these questions from physicians all the time. So no, high levels, high doses of ascorbate do not cause hypertension. And by the way, I absolutely loved your tip on garlic. And as a side note, I was raised since infancy pretty much on eating raw garlic. And I came from a family of world-renowned MDs, PhDs, and it was actually my grandmother also that was giving me a couple of cloves of garlic raw garlic every day. And I learned to love it. So to me, when you mention, well, 10 cloves of garlic a day might be too much, I'm not an Italian, but I believe there isn't such a thing as too much garlic, and I prefer my garlic raw.
Well, we're not going to use toothpaste anymore. We have your vitamin C as sodium ascorbate as our toothpaste for that, right?
Yes, so the unique thing about it, and I actually, on our website, there is a short video. I believe you have to log in as a member, and my better half, who was a world-renowned scientist and a physician and an key opinion leader in integrative oncology, did a video that I only discovered recently. My husband passed away several years ago. And so he did a video for Dr. Bam, who was a biological dentist, and Dr. Bam also passed away. But that video is still with us to remind the clinical importance of ascorbate and biophysical medicine. And so what I learned years ago from Dr. Bam is how to brush my teeth properly. And I don't use commercial products, pretty much not on my skin and not anything that I ingest. And you simply can take, and I think it's also in my book, this protocol, but you can take your toothbrush, simply spray hydrogen peroxide on it. Take a pinch of our SNC product because it doesn't have any additive. It has no preservatives. And I'm saying a pinch in the palm of your hand because you don't want to contaminate the bottle or the jar or the individual packets. The SNC comes in a jar of 250 grams or individual packets of 4 grams, which is basically that's what you tear and put in your SIP 7 to 7 protocol, at least one packet. But if you're needing pharmacological levels, it's much higher. So the jars are great for home use. As I said, these fly off the shelf. And the individual packets, patients love them because I never leave home without it. And so you take a pinch and you put it in your hand and you dunk your wet toothbrush that you just sprayed with hydrogen peroxide on in the vitamin C, and you brush it. It leaves your teeth very clean, very sleek, but most importantly, it reduces microbial burden. But unlike the commercial products that you're using, especially for rinsing your mouth, that will kill everything good in the oral microbiome, this does not. But it kills everything that you don't need, right? So therefore, going back to that cavitation story, if you have a patient with periodontal disease, it is a must. It is a must for them also, not only to do the SIP 7 to 7, but also brush their teeth with it. And again, you can actually prepare solutions for nasal cavity, I mean, in terms of sinusitis or any kind of sinus affections. It can be inhaled. It can be used in for ocular health as a rinse. And as I said, I talk about all of these preparations and how to, and showing you pictures before, after, what kind of things, what kind of conditions you can remedy very quickly with these applications that otherwise most people are not aware of.
So you're saying just the powder, basically dipping your toothbrush there, and then
Correct.
that's it,
And this is
right?
what I'm saying. If you were to recommend one product, so I get to try, I mean, I travel quite a bit. My oxidative stress is constantly through the roof. I'm working 24/7. So by definition, even if I lead a very healthy lifestyle, my oxidative stress is increased. When I'm on the go, and it's not because I do have manufacturing capabilities. I can manufacture anything, but the one thing I don't leave home without always is sodium ascorbate. Remember I mentioned it's the pleiotropic functions: antiviral, antibacterial, antifungal, antihistamine, analgesic, and the list goes on and on. So about a week ago or so, I literally saved my partner's life when he went into anaphylactic shock. And I can tell you that it was so severe that if I had called 911, probably would have been too late. And this was done with essency because I didn't even have time to prepare it in any other form, if you're following what I'm trying to say. So I will share these examples on a different platform that is not being recorded and potentially then later put on YouTube. So you will learn how to, but it is a life-saving critical care. And these are the kind of things that Dr. Klenner documented, as I said, since the 1930s and 1940s.
Right.
And
Well, yeah, there's so many good things about vitamin C.
yeah.
So here's an email question for you. So we mentioned about, so everybody almost in this group is treating Hashimoto's. You mentioned about lowering down antibodies for Hashimoto. So that's one of the bigger challenges in treating Hashimoto's. We use gluten-free diets, right? Dairy-free diets, and even plant sterols. But what is basically the dosing? If you could share that to us on how
Well,
we can
so the
control antibodies.
dosing, you need to understand that ascorbate levels are depleted in an accelerated rate anytime they're associated with increased inflammatory markers, so associated with any kind of chronic disease where we have increased ROS and dysregulated NETs formation. Okay, so by definition, the ascorbate levels are going, and then you have lifestyle factors. We have toxins, we have age-related, just process of aging. Are they on any medications? So you really, in these type of situations, you need to find their optimal ascorbate levels. And on a practical note, unless you're dealing with cancer patients, which I will share with you what you absolutely should be doing, and 99% of providers does not follow these protocols, and I see that all the time. So literally, with cancer care, you don't have the privilege, so to speak, to make a mistake. Okay, precision is your number one priority. If you don't reach those levels and don't maintain them long enough and frequently enough, all you're providing is slap on the wrist. Now, if you're dealing with, for example, you brought Hashimoto's, well, we need to find, and we can take any other condition, right? Whether it's an acute infection, chronic infection, or chronic disease, Hashimoto. I mean, cancer isn't a category of its own. I devoted about 4 hours just on that in that course. But with other situation, it is not practical, and you're not going to be measuring ascorbate levels with every patient every day, because those levels constantly fluctuate. As I mentioned, even if you take a healthy person, I'm relatively healthy, I work out, I get enough vitamin D naturally, I eat, plant-based diet, all organic, all GMO, all of that, but my levels are constantly dipping. And how would you know? You would know when you feel fatigued, when you have a brain fog, right? And remember, I mentioned to you about that patient that bounced back very quickly, that 80-year-old that had cancer. So because it affects mitochondrial function. And here you have accelerated depletion. So you need to find what is their, I call it the happy zone. And the happy zone fluctuates daily and is different from everybody depending on their lifestyle. And how would you know? You've got to get them to their gut tolerability. Now, gut tolerability is usually necessary if you're trying to resolve infection. Here, you're trying to maintain levels. So how would you know? Well, I would start them with maybe 1 teaspoon, but 1 teaspoon is 4 grams. So let me just reach for this and give you an example. So these packets, I hope I'm putting it the right way, S&C, these contain 4 grams, easy to go with, right? This is 250 gram of S&C. I don't know if you could see that. And this is our Ultra C, and we will talk to, I mean, in our library, in the VCICI library, there are videos, actually preparation instructions of how to prepare all of that. But, so you start with 4 grams. But let's take 2 individuals as an example. You have a 70-year-old, 95 pounds, or 115 pounds woman. Now you have a 75-year-old male who's maybe 225 pounds. His disease maybe is more advanced. So his 4 grams is going to be enough right off the bat? No. Now, in rare situations, even with ascorbate, which is not the same as ascorbic acid, because ascorbic acid really will tear up your gut. If I'm telling you they clean toilets and pools with it, when you're putting it to somebody's body, irrelevant in what route of administration, you're causing damage and you're causing discomfort and therefore non-compliance, right? So, but even with ascorbate, some people are either extremely sensitive or they're already at pretty close to being optimal levels. So they might take one of these and that would be enough. They take another one, they're going to experience GI discomfort. That is a cue to you to, or for them and for you to inform your patients to titrate it down. So let's say they started with 2 of these or 2 scoops. This one comes with a scoop. They put 2 scoops in the 7 to 7 large bottle filtered water. And the idea is to sip on it every 20 to 30 minutes. If you don't follow this, now it's not your hydration bottle, it is your sip 7 to 7 bottle. You want gradual distribution for maximum absorption to sustain those levels, because remember, if you're going to remember one thing from this lecture, I said you want to maintain sustainable optimal levels throughout the day. If your level dip like this with hormones, that's not what you want for your patients. Well, it's the same thing that you don't want with ascorbate, especially if they're immunocompromised patients. So 7 to 7 protocol resolves that. And by the way, we get calls from patients every day, asking for this product. We do not sell directly to patients. We have the ability for you to, through Pure C, and those are 2 independent companies, by the way. The VCICI is a nonprofit, strictly educational. But if you go on Pure C and you wanted to drop ship to your patient, you can do that. And patients are constantly calling us who can provide or is supplied for them, and we have to direct them to providers. So that is something for you to take advantage of. Become VCICI certified, be on our list of providers so we can refer these patients to you, whether you're seeing them personally or you're just sending them. And by the way, during the conference, the symposium, we also have legal experts to tell you how you can protect yourself when you are in integrative functional regenerative practice, because obviously you're practicing everything that is under a microscope and you're always a target. So how you protect yourself, whether you do telehealth or anything else.
Right,
So
right.
I hope I answered that question. In order to really understand it, there's a chapter in my book that really outlines all the contributing factors to depletion. What accelerates this rate of depletions and what increases the metabolic requirement. And it's all about that redox balance, because this is where if you're not here, but you're here, your patient is compromised. So whatever else therapeutics that you're using, they are not going to be optimal. If you want to amplify, enhance, and boost it up, you've got to have to maintain, prepare the terrain first. Now, I mentioned that I presented a webinar a week or a couple of weeks ago for the American Academy of Stem Cell Physicians. It is available for free on our website. Do take advantage of it. Do listen to it. There are some great resources, especially if you are in any regenerative, you have regenerative practices, you're doing any kind of biologics. It is amazing what some of our providers are doing with it, implementing it into, in fact, as I mentioned, Dr. Schallenberger was just discussing it with me about a week ago about injectables into joints and with other nutrients and biologics.
You're pertaining to, that's another question here, that's definitely, you have an IV version or intramuscular version of this. Is that correct? That's also in your company?
No, you will learn how to prepare it.
Oh, okay. Interesting.
As I said, if you want the most potent form of vitamin C, it has to be, I can't really comment on it during this lecture, but it's going to be all explained in the certification course. Since this lecture has been recorded for potentially YouTube or anything else, these are not the things that I can really discuss on this particular platform.
Yeah, we stopped right before the
Okay.
the course was
Great.
and books were things, because then we
So
can't
that's
do our
good,
CME
but
things.
I will tell you that